Let's turn our attention to clinical and business model. So as we continue to round out this section of just talking through the trends, what clearly has begun to emerge are some connection points across, and that's important. As we think about the bracket as a whole, it hopefully will help to snap into focus for us what should move forward and what shouldn't, because it may have, one may not move forward in one region, but with some good connectivity in another region, there's some already some notable commentary around that. Clinical and business model, so we've got Medicare Advantage, vertical integration, total cost of care, primary care transformation, omni-channel healthcare, retail healthcare, membership models, specialty care transformation. I'll open it up to the group. Thoughts on this region?
You're not going to lead all of these things we're talking about, whether it's remote patient monitoring, chronic care management, disease-specific conditions, without having your PCPs, your cardiologists, your nephrologists all on board. Because if they don't see some value in it for them, whether it's quality and safety for their patients, but it's also additional revenue for them, it's not going to be successful. Shared savings, things like that with these models, and those just aren't going to work anymore. That's not, the money that you make off of that is not even close to what you're losing in the business as a hospital operator. So we want to do the right things as hospital operators, but you also got to be financially solvent through it. So I think with that, you're going to see more and more systems go at full risk with the payers. And I think that's where the employers coming together along with the health system is going to be really a big benefit, and could be a game changer for everybody. It's forced us into it. Risk was a bad word for the last 10 years. Everybody's afraid of it. But I think now I'm not sure we have a choice but to do it.
The hard thing to do with this particular region is to discern the relative importance of the clinical and business models that in many cases have to be really interrelated. I mean, primary care transformation makes no sense if the economic model isn't total cost of care oriented. It's interesting. It's like there's three components here. There's a clinical design, there's an economics that has to come along that design, and then there's the consumer maneuvering in and out of those. And so I think this is a really dynamic region, and I can't wait to get into some of the matchups.
I like specialty care transformation as sort of a catalyst within particular hospitals and health systems to kind of engage to more of a broader total cost of care.
I got to give them credit that these point solutions are very effective. They're having great results, but when you're my patient and you actually fall into multiple categories, who do you send to for the best type of care possible? Again, because of workforce shortages that we saw last year, because of the great reset or the great resignation, because of the consolidation that we're seeing in rural healthcare, we are going to, this year, I believe, have to think differently about the overall clinical model via omni-channel technologies. When we're talking about clinical and business models, I think we're going to see in 23, because of the challenges of 22, a complete redesign of the clinical model that's enabled by omni-channel healthcare.
We have a whole back of the house of healthcare that is going to be helping to structure and put that this omni-channel experience together to get that clinical model redesigned. No, the workforce is not ready for this, and our research suggests that the workforce is performing at higher levels of the competency spectrum, doing work at more advanced levels in regulatory and accreditation, quality, leadership and integration, and patient safety. All very important, but that was sort of the first generation. That was healthcare 1.0, right? And we're moving into a different environment where we need to be focused on the rest of the competency areas, the rest of the quality work, as I mentioned, pop health, care transitions, data analytics, and our data also suggests that the areas where the workforce is performing at the lowest ends of the competency spectrum on a 3-point scale, that's about a 1.1 in average, is in the areas of measurement, practitioner feedback loops, and payment models. That is the future of healthcare, and we are not going to get where we need to go if we do not have the infrastructure and the people doing the work at the appropriate level to really advance this whole cause.